Good morning. I am Leonie Angelique Camarota, and today I'll be assessing the abdomen. Prior to the conduct of the procedure, first is to review the patient's previous medical record and doctor sheet if available. And next is to prepare the necessary equipment to conserve time and energy. This includes a tape measure, a sharp object like ruler, a stethoscope, and a pillow. Now perform the proper hand washing to protect the patient and me from cross-contamination. Good morning, sir. I am Yoni Angeli P. Camarota, your student nurse for today. Since you don't have an armband with you, can you verify your full name and date of birth?
My name is John Michael P. Camarote, and my birthday is 2007, November 14, 2007.
Okay. And what would you like me to call you?
John will be fine.
Okay, John. So today I'll be assessing your abdomen in order for me to identify if there are any alterations or problems to prevent further implications. So for your privacy, I already closed the door so that no one from the outside will disturb us while doing the assessment. And I encourage you to void first so that it will be much comfortable with you in doing the assessment. So did you void already?
Yes, I already void.
Okay, and don't worry, all the result here will remain confidential. Do you have any questions or concerns before we start the assessment?
No, nothing.
Ensure that the patient has emptied his bladder before doing the procedure to avoid discomfort during the assessment. And because a full bladder can reduce the accuracy of bundle height measurement. Next is position the client in a supine position. So, sir, can you please lay your back here? With arms folded across the chest or resting by the sides. Okay? And then, place a pillow underneath the patient's knee for this position. Ensures abdominal muscle relaxation to avoid putting additional pressure on the abdomen of the patient's abdomen. Next is to cover the upper and lower body parts of the patient, leaving only the abdomen exposed. So, sir, do you have any pain in your abdomen or any constipation or diarrhea?
No.
Okay. So, I'll begin in inspection first on the 4 quadrants and note for any vascularity, scars, and stretch marks, and observe for any pulsations as well as the umbilical area. Umbilical area skin tone should be similar to the surrounding skin tones in even pinkish. So it should be round and also conical, and don't forget to observe for any presence of masses or bulges suggesting ventral hernia, which is a protrusion of the intestine or other tissues. Okay. Now to inspect the abdominal contour and symmetry while the patient lying supine in the bed, sit aside on the client and look across the abdomen at a level slightly higher than the patient's abdomen. Okay. Then stand at the foot of the bed and observe for abdominal symmetry. So while doing the inspection, observe also for any abdominal respiratory movements, aortic pulsation, and peristalsis. Okay. Now, measuring the client's abdominal girth by placing a measuring tape around the patient's abdomen at the level of the umbilicus. Abdominal girth should be measured at the same time of the day, ideally in the morning, just after voiding. So, sir, can you please sit down? Okay, can you take a measure? You can now lay back again, sir. Okay. Now, sir, I'm going to start listening over your abdomen. So, can I ask, when did you last eat?
Last night.
Last night. Okay. Recent intake may have increased the peristaltic activity. So, now warm hands and the diaphragm of the stethoscope to avoid startling the patient of the coldness of the stethoscope. Now, auscultate all 4 abdominal quadrants for at least 1 minute each. Starting from the right lower quadrant and proceeding in a clockwise pattern. Also noting the intensity, pitch, and frequency of the vowel sounds. Okay. To listen for the vascular sounds, use the bell of the stethoscope and listen for a breathing over the abdominal aorta, renal iliac, and the femoral arteries. Now, to listen for the friction rub, use the diaphragm of the stethoscope over the liver and the spleen. Okay. For the percussion of the patient's abdomen, percuss several areas in each of the 4 quadrants to determine the presence of tympani or high pitch sounds that indicates a hollow space filled with air, and also dullness that suggests fluid or fluxes. So, now start in the right lower quadrant. Now to percuss for the vertical liver span at the mid-clavicular line from the right lower quadrant along the mid-clavicular line, percuss upward towards the liver. And note the changes of tympani to dullness and mark this point. So sir, I'll mark your body. Okay. Now, percuss on the right clavicular line on the area of the lung resonance around the third intercostal space, and percuss downwards to the liver. And note again the change from lung resonance to liver dullness, and mark this point. Now, proceeding at the mid-sternal line, starting just above the umbilicus, percuss upward toward the liver, and note again the change from tympani to dullness, and mark this point. Now, for the upper border, start percussing at the body of the sternum along with the third intercostal space, and percuss downwards until the tone changes from flat to liver dullness. Now, measure the distance between the 2 points. Now, to assess for the liver descent, ask the patient to take a deep breath and hold it while percussing the right lower quadrant towards the liver, and note the changes from tympani to dullness, and mark this point. So, sir, can you please take a deep breath? Okay. And now measure. Next is an assessment for the spleen and the evaluation for splenomegaly. Reposition the patient in a right-sided lying position. So, sir, can you turn to the right? Okay, with the left knee flex and identify the left anterior axillary line. Now, percuss the left anterior chest wall through roughly from the border of the cardiac dullness and of the cardiac dullness of the 6th rib to the anterior axillary line, and down to the costal margin. Now, don't forget to ask the client to take a deep breath and percuss again. Sir, can you take a deep breath? Okay. Now, exhale. Okay. In percussing the liver, have the client sit with his back to you and place your left hand fist against the lower right anterior rib cage. So, sir, can you please sit down? Okay, can you please hold your pose for me? Use the ulnar side of the right fist and strike the left hand. Okay. Okay. Now, you can now back to your position. So with the patient lying in a supine position, percuss the flanks of the patient from the bed towards the umbilicus, noting the change from dullness to tympani and Marquis point. Now reposition the patient to a side-lying position and percuss the abdomen from the abdomen upward, noting for the change from dullness to tympani. So sir, can you roll to the side, to your side? Okay. For the fluid wave test, ask the patient to press the edges of his hand firmly down the midline of his abdomen. So sir, can you roll back again? And can you press your hands like this? Okay. And now tap one flank sharply with fingertips to feel for a fluid wave transmitted across the opposite flank. Okay. And, so proceeding now in palpation, I'll be using two approaches in this procedure. One is light palpation and the other one is deep palpation. So I'll be assessing if the patient felt any tenderness or pain upon palpation. So sir, do you have any pain in your abdomen right now?
Yes.
No? Okay. Now palpate all four quadrants using finger pads, initially avoiding any areas that the patient had identified painful. Now observe for reports of pain, tenderness, or guarding behavior and masses. Do you have any pain? Now perform deep palpation to feel for the internal organs and masses. Compress the abdomen to a maximum of 5 to 6 centimeter using the palmar surface of the hand and palpate for masses. Now palpate, I perform moderate palpation at the umbilical ring, noting for any presence of masses, swelling, nodules, or granulations to assess for tenderness and presence of mass. Now, to palpate the abdominal aorta, you use both hands to deeply palpate the epigastrium slightly to the left. Okay. Now, palpate for the liver to assess for any liver contour, presence of nodules, tenderness, and irregularity. So place left hand under the client's back and under the level of the 11 to 12 ribs, while the right hand is laid parallel to the right costal margin with fingertips pointing towards the client's head. Okay. Now instruct the client to take a deep breath and compress the fingertips upward and downward, noting for consistency and tenderness. So can you take a deep breath? Okay. Exhale. Now in performing the hooking technique, stand at the right side, facing his feet, press in and upward the costal margin with your fingertips, and ask the patient to take a deep breath. Then gently pull inward and upward with your fingers, noting for also consistency and tenderness. Okay. Now, to test for the cholecystitis, press fingertips under the liver border at the right costal margin and ask the patient to inhale deeply, noting for right upper quadrant pain and tenderness. Can you explain? Take a deep breath. Okay. Exhale. Okay. Now, in palpating the spleen, stand on the right side of the client and reach over the abdomen with your left arm and place your left hand on the place your left hand under the posterior lower ribs and pull up gently. Then place your right hand below the left costal margin with the fingers pointing toward the client's head. While palpating the spleen, stand on the right side of the client and reach over the abdomen with your left arm and place your left hand under the posterior lower ribs and pull up gently. Now, place your right hand below the left costal margin with the fingers pointing toward the client's head. Also, and ask the patient to take a deep breath. So, sir, can you please take a deep breath? And press inward and upward while providing support. With the other hand, noting for tenderness and consistency. Next is to palpate the kidneys. Assess for kidney enlargement. Stand at the patient's right side and place your left hand under the patient's right posterior flank and the right hand at the right costal margin at the mid-clavicular line. Then instruct the client to take a deep breath. So, sir, can you please take a deep breath? And compress fingers during the peak of inspiration. Take a deep breath. Again, hold it for me. Okay. Now, to test for appendicitis, palpate deeply at 90 degrees into the abdomen, halfway between the umbilicus and the anterior iliac crest, then suddenly release the pressure. Now, listen and watch the client's expression of pain and ask which hurt more, pressing in or releasing. So, sir, which hurt more, pressing in or releasing? Pressing in, okay. And where in the abdomen the pain occurred? So, where did the pain, sir?
The moment you press in.
Okay. And now, to test for the psoriasis sign, reposition the patient in a right side lying position and hyperextend the right leg. Okay, sir, can you please roll your back there? Okay. So, sir, can you tell me if you feel any pain? Do you feel any pain?
No.
Okay. Sir, you can now go back to your position earlier. Okay. Now, to test for the obturator sign, hold and support the client's knee and ankle. Okay. And then flex the hip and knee and rotate the leg internally and externally. So, note also for any pain or reaction of the client. So, do you feel any pain?
No.
Okay. So, pain in the lower quadrant indicates irritation of the obturator muscle due to appendicitis. Now, for the hypersensitivity test, using a sharp object, stroke on the abdomen several times and note for pain or any reaction. Sir, do you feel anything?
Yes.
Okay. Do you feel any pain?
No.
Do you feel any pain?
No.
Okay. Pain felt on the right lower quadrant is a positive skin hypersensitivity and may indicate appendicitis. Sir, you can now sit down. So, sir, now that we're done in assessing the abdomen, so here is the summary of your assessment. So, upon inspection, your skin is uniform in color, no lesions, no scars, no rashes, And umbilicus is in the midline and inverted, which is pretty normal. And your abdomen is symmetrical. And while I was listening to your abdominal sounds, it is pretty normal, no brewy or any venous humps. And while I was hearing for your and while I was measuring for your size on your level span at the mid clavicular line here, so I measured it at 7 centimeters, and for the mid sternal line, I measured it in 5 centimeters. And upon percussion and inspection, no tenderness or bulginess on masses, and overall your abdomen is pretty good. Now, do you have any questions or clarifications, sir?
No, thank you.
But before I leave, I will just like to give you some advice on how to keep your abdominal organs healthy. So first is to avoid drinking alcohol or too much alcohol, and might as well increase your intake, your liquid intake, such as water to help cleanse your body. And lastly, don't forget to delay if you want to urinate. That's all. So we're done, and thank you for your cooperation.